today we learn about the bronchoscopic anatomy of the lung. So how the lung look from inside. So till now we see in our first year that we see the lung grossly from the outside. So how the lung look outside? You all know that the right lung and the left lung, the two lungs. Okay, the right lung is having the three lobes. One is the one is upper lobe, one is middle lobe, and one is lower lobe, which is separated by the three fissure. One is oblique fissure and one is horizontal fissure. Okay, this oblique fissure divided the upper middle from the lower lobe bronchus, and this horizontal fissure that separated the middle lobe from the upper lobe bronchus. And the anatomy on the left side is different. So on the left side you will only have the two lobes. One is the upper lobe and the one is lower lobe. Upper lobe is having upper main division, and the something is called lingular division, okay, which is near the heart. And this is lower lobe, which is separated by the a large oblique fissure. So to see the lung from inside, we need some what structure that will go inside the lung. So it is done by the two ways. Okay, it is done by the two ways. One, we have a virtual bronchoscopy, and one we have a bronchoscope. The bronchoscope is having the two types. One is fiber optic bronchoscopy, one is having rigid bronchoscopy. This is called flexible bronchoscopy. The flexible bronchoscopy is of two types. One is fiber optic bronchoscope and one is video bronchoscope. Okay? There are two types, and how they look differently, see in the photos. Okay, how these two structures look different, see. So there are two types of bronchoscope basically. One is a fiber optic bronchoscope, this one, and this is video bronchoscope. For the difference, the fiber optic bronchoscope is having an eyepiece over the head, and in these there are no eyepiece, so there are no eyepiece. So it is directly connected to the video, which is attached to this wire. Okay, here also this part is connected to the light source, and when we convert this flexible into the video, we mainly put a coupler over this over the head, and this attached to the television. Okay, so the video will come from the fiber optic bronchoscope. So let us now learn about the anatomy of the lung, how lung looks from inside. So basically there are different approaches to go inside the lung. Okay, we have a nasal route, we have a nasal route, we have a oral route, we have a endotracheal tube route, and when we have a tracheostomy route. There are so many ways to do to go inside the lungs, tracheostomy. So when we go inside the lung, so first see the video, and then we ask some certain questions to it. Okay, in this video we mainly enter from the nasal cavity sides. Okay, this is nasal cavity, and when entering through the when we exit through the posterior nares, the first structure to visible is epiglottis. Remember, epiglottis is a leaf-like structure. This one is epiglottis. This structure which is visible just now is epiglottis. This structure which is a leaf-like structure is epiglottis. When we turn the lever up, it means down. Lever up, it means down. We'll see a structure called as vocal cord. This vocal cord is inverted V-shaped structure through which we enter inside the lungs. We mainly enter through the posterior side of the vocal cord so that the patient will not cough excessively. When entering inside the vocal cord, we'll see a structure known as trachea. The trachea is basically covered anteriorly by the cartilage and posterior by the fibromuscular structure. This is incomplete C-shaped cartilage, which protect the trachea from collapse from the nearby structure. This posterior part is not covered by the cartilage, so this look like the muscular layer. This is fibromuscular layer which bulge anteriorly during the coughing. On entering inside the trachea, the structure that we'll see is the carina first. Okay, you see this is the this MC part is main carina. This is RMB is the left main bronchus and the right main bronchus. This LMB is the left main bronchus. So which side is enter first? It is decided by the CT scan or any other radiographic investigation. The structure which is normal is examined first and then we enter inside the infected or pathological side. So if in the CT scan, if the conservatism seen on the right side, then we go inside the left side first and then enter then enter inside the right side later on. So this is just a video what anatomy. So we first enter inside the left side and then we go the left. First we go inside the right side and then we go inside the left side later on. See, this is right main bronchus. This is, we turn the bronchoscope 90-degree clockwise and the structure which is visible. See, when we enter inside the right side, this is trachea, this is, we see the carina here. When we enter the right side, this is called right main bronchus. The right main bronchus is further divided into the two main structures. One is upper lobe division. This is called bronchus intermedius, BI, the right side. This upper lobe division is further divided into three bronchopulmonary segment. Okay. This is RB2, this is RB1, this is RB3. This nomenclature should remember. RB1 is the apical segment, RB2 is a posterior segment, and RB3 is anterior segment. So first look this in the video. This right RUL is right upper lobe, which is on the 1 o'clock position of the clock. When we enter inside the right upper lobe bronchus, you will see the three further segment. One is RB1 is apical segment, RB2 is posterior segment, RB3 is anterior segment of the right side. There are three structures. When we withdraw the bronchoscope and go inside the bronchus intermedius, and at the end part of bronchus intermedius, you will see the three structure basically. You will see three structure. This is bronchus intermedius. When we go in the bronchus intermedius, you will see three structure at this part. This on the 9 o'clock position is middle of bronchus. This is basal branch, and this on the 3. This is on the 9 o'clock. This is on 3 o'clock. Okay. This 9 o'clock position will see the middle of bronchus. This 3 o'clock is having superior segment of right lower lobe. This nomenclature as RB6. This middle of bronchus is further divided two part. One is RB4 and RB5. RB4 is a medial segment. This RB5 is lateral segment of the middle lobe. ठीक है ना? RB4 and RB5. And further, this basal branch is further divided into 4 segment. Okay. Okay. This is called medial basal segment RB7. This is called anterior basal RB8. RB9 is lateral basal. This is RB10. It is posterior basal. So basically, the right side is having 10 segment. Okay, RB10 हो गया. It's having 10 segments, but normally this medial basal is present normally in maximum proportion of the patient, but in some variant it is not present. It is absent on the left side permanently. When it is present on left side, it is variant, but on the right side medial basal is present normally. When it is absent, it is a variant. Okay, now see in the video. On entering inside the middle lobe, right side middle lobe, you'll see the two structure. RB4 is the lateral segment of the middle lobe. RB5 is the medial segment of the right middle lobe. And on entering inside the lower lobe, the RB6 is the first structure to visualize superior segment of the lower lobe. Then on entering inside the basal branches. So this is one variant. You see here RB7 is not present, RB8 is anterior basal, RB9 is a lateral basal, RB10 is a posterior basal. So in this patient, it's a variant because right side middle basal is normally present, but here it is not present. It is a it is just a variant. How look how it look like when RB7 is present. See, RB7 is present in different patient, like it is present normally. So it is a middle vessel is present in this patient. This is normal. Okay, this is normal anatomy. And how to remember the lower lobe bronchus? So I remember in a fashion of what? In clockwise direction always. Medial basal first, then anterior, then lateral, then posterior. I remember by the mnemonics Malpani. Okay, this is medial basal, this is anterior basal, this is lateral basal, this is posterior basal. This is in clockwise directions. This is clockwise direction. Okay. Now we draw the bronchoscope and see how the left side anatomy is different from that of right side anatomy. Okay. Remember one thing. Left side is very difficult anatomy. It is completely different from that of the right side. So first see the notes. Okay. See in this. So how the left side is look. Okay. This is right side. This is left side. Okay. We all studied about right side. Now see the left side. Left side is having further. It is divided in two part first. This is upper lobe, left upper lobe bronchus. This is left lower lobe bronchus. And how? Because when we enter into the left side, it's very difficult to know which is left and right. So remember one thing: the posterior part of the bronchus, which is look like the linear shadows, white like shadows, which is the fibromuscular layer, they always advance toward the lower lobe bronchus. So by tracing the posterior part of the bronchus, you enter inside the left side first. On the left side, we know that medial basal is left middle basal is permanently absent. Okay. The left middle basal is permanently absent. So we're starting with the what? LB6. This is superior segment. Then we enter inside the anterior basal, left anterior basal. Okay. Then this is left lateral basal. This is left posterior basal. Okay. On the upper lobe bronchus, you see the two structure divided, further segment into the two structure. This is superior, not superior. This is basically lingular segment. Lingular is further divided into the LB4 and LB5. Superior lingular and inferior lingular. And the upper lobe bronchus is further divided in two parts. This is LB1 plus 2. This is basically apico-posterior. Is further divided into two parts. LB1 and LB2. This place is very difficult to go. Okay. And this anterior division LB3. This is anterior segment of left upper lobe bronchus. Okay. This is LB3. Now see in the video. We go inside the left side, and you'll see this linear structure, which is the posterior part, they advance toward the lower lobe. See this linear structure, which is supposed to be advanced toward the lower. So this is lower lobe, this is upper lobe. Upper lobe structures having lingular is visible. Left carina 2, this is lower lobe, in which LB6 is mainly seen, which is superior segment. Okay. So first we enter inside the left side. You see this is the LB6, this is superior segment of the left lower lobe. which is further divided into the three segment ABC. Now we enter inside the basal branches. In the left side, middle vessel is completely absent. So we have a left anterior vessel, left lateral, and left posterior vessel on the left side. Right side is having a 10 segment, left side is having only the 9 segments. Which segment is absent? It is medial vessel is absent. Now we draw the bronchoscope and to see how the left upper anatomy is different from that of the right upper anatomy. So we know that the right upper anatomy is further divided into three parts. One is apical, anterior, posterior. But on the left side, it is first divided in two parts: lingular segment and left upper proper division. And on further advance in the left upper proper division, we see a two structure separating. One is apico posterior, one LB1 plus 2, and LB3 is anterior. And when further advanced into the left apical posterior, it is having further divided two types. One is LB1 is what apical, LB2 is posterior. See, this is upper lobe bronchus. We have a upper proper division and which is separated by the LC1. This is lingular division. First we enter inside the lingular division. Lingular is two part, RB4 and LB4 and LB5. LB4 is superior lingual, LB5 is inferior lingual. It is just near the heart. Okay, so this bronchus, this, how to remember this? We enter inside the lingular because this bronchus, this look like pulsatile. So we confirm that this is a lingular segment. On entering inside the upper division bronchus, we see the two structure. LB1 plus 2 is apico-posterior, and LB3 is anterior division. So it is very difficult to enter further inside the LB1 plus 2. But when we have an ultra thin bronchoscope or just a 5 millimeter bronchoscope, we enter inside the apico-posterior segment also. So this bronchoscope will enter inside the apico-posterior and see how it further divided into the left side in apical and posterior division. See. This is LB1 and LB2. LB1 is apical segment, LB2 is basically the posterior segment of the left upper lobe bronchus. This is the whole anatomy of the lung bronchoscopically or inside the lung. Next time we'll upload some new videos of the lungs by different approach. Thank you.